there's not enough of us. There's not enough occupational therapy practitioners working in early intervention. If you are an OT practitioner or a student, once you become a practitioner and you have a passion for early intervention, you have a passion for private practice, do it.
The main finding of today's article from JAMA is extremely promising for early intervention OT professionals. In the study, greater early intervention service intensity was associated with better functional gains. But there's a problem. Federal spending per child on early intervention services has declined over the past decade. And in this climate of tightening budgets, the research found that most children in the study had delayed care and low service intensity. After we review this article, we are so thankful to welcome to the podcast pediatric private practice owner Sarah Putt, OTRL. Her and I will unpack what this all means for the OT community and for your OT practice. So let's dive in. Welcome to the OT Potential Podcast, where we review new and influential OT journal articles, then invite on an expert guest to help us pull out actionable takeaways that you can implement in your practice starting today. Welcome to the podcast. I'm your host, Sarah Lyon, OTRL. And before we dive into this topic of early intervention, timing, and intensity, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. So bearing in mind that this could count as a CEU course, I wanted to state our 2 learning objectives so you can be thinking about them throughout the podcast today. Our first learning objective is you will be able to recognize barriers to reaching a therapeutic level of therapy intensity in early intervention. Our second is you will be able to identify possible solutions to providing greater intensity for greater functional gains. So let's begin by looking at this journal article, and then we will bring on Sarah to discuss how this research could play out in your practice. The article we are reviewing today is called Timing and Intensity of Early Intervention Service Use and Outcomes Among a Safety Net Population of Children. It comes to us from JAMA, and it was published in 2019. So the article begins with this big picture introduction to early intervention services. The Individuals with Disabilities Education Act, or IDEA, provides state funding to establish early intervention services for infants and toddlers with developmental delays and disabilities. To help ensure timely delivery of these services, federal policy clearly mandates that an EI care plan should be written within 45 days of referral. But despite this mandate, previous research on service timeliness has suggested that children living in poor neighborhoods have less timely EI access, though this research is well over a decade old. How much early intervention children should receive is less clear. While guidelines on pediatric service intensity do exist, I'll link to those in our show notes, these studies are also outdated. Plus, they are not specific to early intervention. Luckily, new reporting requirements are enabling a deeper understanding of EI service delivery. State EI programs must now report a children's function at EI entry and exit, which leads us to this paper. So what was the intent of this research? The authors sought to examine data from primary care referral through EI exit and look at the outcomes in order to determine the timeliness and intensity of EI services and the association between service intensity and functional outcomes. Because our nation's lowest income families have been shown to face greater barriers to EI access, the authors of this study chose to examine data from a large urban safety net system. So what were their methods? For this cohort study, the researchers conducted a secondary data analysis examining EI records from the Denver Health and Rocky Mountain Human Services Early Intervention Program. This large safety net system serves around 50,000 children annually. Looking at the participants in the study's sample included all children who received well child care visits between October 2014 and September 2016. These children were younger than 35 months at the time of service, had a diagnosed condition or developmental delay. The database used for the study categorizes patients based on the following 4 chronic condition tiers. 1 was no chronic health conditions. 2, mild severity, for example, vision or hearing loss, cleft lip palate, central nervous system anomaly. 3 was moderate severity, such as autism, intellectual disability, or very low birth weight. And 4 was greatest severity, such as cerebral palsy or spina bifida. The database also includes information on race and ethnicity, household income, sex, and primary language. So what outcome measures were used? The timeliness of EI was calculated based on the number of days from referral to care plan creation. Service intensity was calculated overall and for each individual care discipline. Those include PT, OT, SLP, and developmental intervention. Typically, this was educational play and social interaction skill development. Functional outcomes represented the difference between exit and entry on the child outcomes summary form. So what were their results? 722 children in the sample received an EI care plan. Of those, only 525 initiated services and only 448 completed functional outcome information. So looking at the service use timeliness, only 43% of children in the sample received an EI care plan within that 40 days of referral. The median number to days to care plan creation was 56. Looking at service use intensity, the median intensity for all services was 2.7 hours per child per month. Children from families who were above the federal poverty level received more intensive OT. And children with a race and ethnicity categorized as other non-Hispanic, for example, Asian, Pacific Islander, or a combination of more than one race, received less intensive OT services. Looking at their functional outcomes, 1 additional hour per month of EI services was associated with a 3-point gain in functional outcome scores. This is a clinically meaningful difference. For example, an increase from a score of 3 to 6 on this outcome form represents a change from, quote, child does not show functioning expected of their age in any situation, to, quote, child's functioning is generally considered appropriate for their age, but there are some significant concerns about not keeping pace with expectations. So headed into the discussion and conclusions, the authors found that greater EI service intensity was associated with gains in social, emotional, cognitive, and adaptive and/or behavioral function. This is the first research of its kind, and at this point, the relationship is an association and not necessarily causal, so further study is needed. The study also suggested that more than half of the children in the sample received delayed and low-intensity EI care. This is consistent with previous research indicating that EI intensity falls well below therapeutic levels. The finding that children from families below the poverty line received less OT is also consistent with previous research. Although the study cannot determine the reason for this, previous literature suggests a lack of communication between medical systems and EI services, which may be to blame. The strength of this study was that the researchers were able to link primary care data and EI program data, which allowed them to follow children from referral to service provision. This type of data system integration could serve as a framework for other institutions to track EI-referred children and link needs, services, and outcomes. Okay, there is a lot to unpack from this research. I definitely encourage you to read this article in full. It was a super interesting one. So to talk about this, I am just so thankful to have a returning guest to our podcast, Sarah Putt. Sarah Putt is a licensed and certified occupational therapist. With over 13 years of experience in early intervention, she is a founder and clinical director of Sarah Bryan Therapy in Los Angeles, California. Her company specializes in therapy interventions in the home environment and typically works with children from birth to 3 years of age. Sarah is also the host and creator of OT for Life, a podcast and website dedicated to sharing her passion for the field of occupational therapy with other practitioners and anyone interested in the field of OT. She is also the co-host of 2 other occupational therapy podcasts, the OT Roundtable and the Real OTs of Early Intervention. Sarah loves talking about all things OT, podcasting, and early intervention. So without further ado, I will patch Sarah into this podcast. Welcome to the podcast, Sarah. It's great to have you.
Sarah, it is such an honor to be back on the show. Of course, talking about early intervention. Thank you so much for having me and letting me come back on and talk even more.
I am so thankful you're back. Every time you come, I get so fired up because I look at these EI numbers. And the thing I'm really thinking about this morning is I read this study right before you got on. It came out of Denver, and they were looking at the number of eligible people for EI who actually made it to services. And they found that 25% of kids who were eligible got a referral. And of the total, only 5% actually made it to EI services, which blows my mind, especially given the research we're talking about today. And I feel like this is the topic to talk about in EI. When you came on before, we talked about EI and motor performance, but it feels like the real challenge is just getting to EI. So I'm really excited to dig into that today. Before we get there, though, I want to hear a little bit about your private practice and your EI service delivery. Just so we could get oriented a little bit to that.
I could talk about this all day. So I started and I run my own private practice, and it specializes in providing early intervention services to kids that are birth to 3 years of age. We provide all of our services in the home or utilizing any sort of community supports or anything like that. So going to parks or libraries, any sort of community resources that are out there. I do not have a brick and mortar, and I don't know if I ever will. We'll see. And most of the funding that I have for my company, I would say, is early intervention related, but we also do service some private pay clients as well. And when I first started my practice, it was just me. And actually, even before I started, I really thought, I was just going to start my own thing and it was just going to be me and that was going to be great. But after, it wasn't even a year into starting my private practice, I knew that I wanted to hire on more employees and hire on a team to really kind of build out everything that we can do and all the supports that we can put in place for early intervention within the Los Angeles area, which is where my private practice is located. And so now, it has been almost 10 years. I'm just shy of hitting 10 years of my private practice, which is just, every time I think about it and say it out loud, I'm like, wow, a decade. That's a long time. That's a really long time. And to think that it was just kind of a small little dream of mine, that here I am 10 years later, okay. I digress on that one. But I have a team of therapists that work alongside me. So I right now have 3 employees and 1 independent contractor. They are the most amazing people and therapists that I have ever had the chance to work with before. And we're really looking forward to kind of the next steps and really what we can do in building out supports and services for this, such a needed population within our communities. And I love it. I mean, it lights me up every day. And I love being able to support the kids, support the families, support the therapists that work alongside me, and really do the best that we can for everybody.
Yeah. Oh, that's so awesome to hear. It's so interesting to think about those stats I just mentioned, where if all the kids who needed EI were getting there, we would need your practice to grow tenfold. That's how big the need is that's out there. I was trying to do the math in my head. Did you start your practice right away out of school, or did you get work experience before starting it? I'm really curious about that.
Yeah, so I had been working for about 4 to 5-ish years before I started my practice. So yeah, like another crazy thing to think about is like I've almost been an OT for 15 years, which is even weirder to me. But yeah, so I did work for another company for a few years, and then that kind of led into doing some independent contracting, and then for multiple companies, I should say, and then that kind of led into starting my own practice. And I know I did talk about that a little bit more in detail on my first episode with you. So if people are interested in hearing specifically how that all kind of came together, they can go listen to that episode because I talk about it there.
Awesome. So I love this background that you have and being in it for 10 years. And I'm so curious to hear what you thought of this article. Did it align with what you see? I don't know. What were your impressions of the research?
So first and foremost, I have to point this out, and I'm going to call it out because there were no OT practitioners. There were no occupational therapy practitioners involved in this research. And it's funny because I read the article, and then I read it again, and then I read it again. And I had read it a handful of times, and then all of a sudden I was like, wait, hold on. I need to actually go back and look at who was doing this research. And there was a PT, and then there were a few academic researchers from public health. And that was it. And I was like, no, this is not okay, right? Like, get on a soapbox here, but we need to have OT practitioners be involved in this research, especially when it's something they're talking about OT in the article. Not just once, not just like a offset of like, oh, this is something else that could happen. Like, no, OT was one of the big things that was mentioned time and time again and looked at in the article. And then, tying it to early intervention, OT is a huge part of the early intervention team. So we need to get more OT practitioners involved in research, especially when it's research that is involving us.
Yeah. Yep. Yeah. And our OTs who are in academia, I can only think of one who does some early intervention research. There's probably just not enough OT researchers who make this their primary focus. And it is such an important area of practice. I think that's something we need to like re-examine as the OT community. It feels like, are we getting distracted by other things? Because this is an area where the clinical efficacy of what we're doing is there. And that is not true of all the areas of OT. Like there's some areas where we're still trying to figure out what works, and early intervention is something that works. There's systems behind it to support it. It's a way to have early intervention practice that's feasible. Like it is such a special part of our profession for so many reasons. And I feel like maybe we've gotten a little distracted.
Yeah, or we just need that more awareness. And, for years I've been thinking about potentially going back to school and getting a doctorate or something like that. And hey, yeah, it's my passion. So maybe this will inspire me to go back and jump into getting more OT practitioners involved in early intervention research. But I also think, kind of anecdotally, in what I've seen in my practice and my experience over the past, decade to 15 years, specifically, I did see a lot of similarities with what the article was talking about, specifically when it comes to the delays in providing care, and then also the intensity, right? Or maybe lack thereof, lack of intensity. And you know what? We do see that where kids are not starting right away. Maybe they're not getting the amount of services that they need. So yes, I feel like generally speaking, I do agree, and I do see a lot of what is happening that the article pointed out, specifically within my practice. And of course, that this is one location, and there's lots of other places in the US and in the world. So I'm not entirely sure kind of across the board, but I am seeing very similar things. But another thing to kind of just kind of keep in mind as we're talking about this. And this was something that really was kind of highlighted as I was reading it. It's very easy to kind of read these articles and be like, oh, well, the early intervention team needs to do better, right? They need to have better services. They need to do better at all these different things to make sure that the kids are getting seen on time and make sure that they're getting all the services that they need and all this kind of stuff. And I think there's so many other factors that can kind of play a role that it's not always, not saying that it's that it is the early intervention team, and it's not always their fault or something like that to why this is happening. There are plenty of reasons that like family reasons that maybe kids aren't starting on time, or just life events or anything that kind of happens like that route about it. And also, like, when it comes to the intensity part of it, I know in the article they're saying, that getting that like one additional hour led to so many additional gains. But when we're really talking about client-centered care, sometimes the kids and the families might not be able to tolerate more services than what they're getting. And it might not be the best for that client and that family. We still need to touch on the active parent engagement, right? We need to have parents and caregivers involved and carrying over the stuff that we are doing within our therapy sessions. We also just need to pay attention if it works within their routines, their daily lives. Can the kid even handle how many hours that they are getting of that therapy, whether it is OT, PT, speech, you name it. And so I think it's really taking what the article has said and blending that with our practice of what we're actually seeing in the field, and making sure that what is really truly necessary supports and services for each child and family, and make sure that they are getting that. That's bottom line.
Yeah. It seems like an area where you're never going to see perfect numbers. You're never going to see 100% for so many reasons. That's not realistic that every child that gets referred is going to get those services, but we can do better. And I'm going to link to another article that I read this morning about how it was out of Boston and they improved their referral system, and they got their number of people who were getting referred and got to services, they got from 50% to 70%, which is a huge improvement. So there's huge rooms for improvement, but there's also, we'll never be perfect for so many reasons.
Yeah.
I wanted to highlight just that 1 hour led to these higher levels of improvements. I appreciate your point that sometimes that's not true for everyone, but why do you think they saw that number? That improvement, that was really surprising to me. And it wasn't really it was just an association, so we don't know if it was causal, but I don't know. What did you think about that?
Yeah, I think we need more information of what that actually was. Like, what was the number that they were at, and where did they get to, right? Like, are we talking about a kid that was getting maybe 1 hour a month and then all of a sudden it bumped up to 2? Or are we talking about kids that were getting maybe 5 hours a month and it bumped up to 6 or something like that? Or even in my area, the most that we can be authorized to see a kid would be 10 hours a month, which is huge. Doesn't happen very often, but that generally speaking, that kind of boils down to like twice a week. And so I'd be really curious to get a little bit more information about what the numbers actually were. Were we kind of on that low end and it was bumping it up a little bit, or were we actually on the higher end? If I had to guess, I'm guessing we were on a very low end where they weren't getting much at all. So then, yeah, getting one more additional hour definitely is going to make a difference as well. And I know that like any sort of like therapeutic intervention is going to be beneficial, right? But it's all these other kind of factors that schedule and, timing and just the kid and the family and all that kind of stuff. Like, they might have really limited availability, and you just might not be able to actually go and see it, right? And it could be the kids' availability, and it could also be our availability as practitioners. So it's, I try to look at it from both ends of like what is the most necessary, and how can we best support these families given the situations that we got.
Mm-hmm. Yeah. We've said a couple of these already, but I wanted to just explicitly ask about these barriers to referral and getting that higher level of intensity. And there's so many barriers. I guess I want to prune it down a little bit to be like, what are the fixable barriers that you see in your practice? There's some barriers that we can't fix. What are the ones that you see as something we could do about, I guess specifically in your practice, what you see?
I think the biggest one, and this I think just kind of ties into a lot of different things that we could talk about. It's funding. There is a lack of funding for early intervention programs, supports, and services across the board. And without funding, it's hard to run an adequate program, not even a good program, one that is able to meet the basic needs of population and society. So funding, first and foremost, like we definitely need more funding for early intervention. And this would tie into the program, what can actually be provided, the services that can be provided, the personnel to staff the program, and everything, like the whole entire robust program, or hopefully robust program that we could have. So funding is huge. And, I feel like that's a whole nother episode there, just talking about how we can actually get more funding for early intervention. But that's a hard one. And I do want to point out, like, I feel very fortunate for where my private practice is. The funding is actually pretty good where we are, quote unquote, pretty good, right? Like it can definitely be better. But I do know in other areas, like it's really bad. And that's hard as a practitioner because you want to be able to be paid what you're worth. And if the funding is not paying that, it's not going to draw people into that practice area and draw people in certain states that might have lower funding. They're not going to work in early intervention because they can't make ends meet, right? They can't get paid what they're worth. And so that is, funding is such a big thing there. And in that same vein, like I was just talking about, like the numbers of providers, there's not enough of us. There's not enough occupational therapy practitioners working in early intervention. And outside of OT, speech, PT, vision, hearing, behavior, social work, there's not enough specialists that actually provide services to the kids that need it in early intervention. And a lot of that is due to funding, but a lot of that can also be due to kind of the nature of the practice area, because a lot of the times you are going to the clients' homes, you're by yourself. You can feel isolated. You drive a lot. Let me tell you, my practice is in Los Angeles, California. I understand driving. I understand traffic. There are days that sometimes I will spend 3 to 4 hours total in the car, 15 minutes there, 30 minutes, whatever, that's just how it is. We are constantly driving. And I think another kind of reason that kind of scares people away from working in early intervention is mentorship or lack of mentorship. That because you are by yourself, you're not at a facility where there are other people around, or you have a supervisor that's right there, or you're in a clinic and you can be working with a kid and somebody can be observing you, right there without having to drive to the house with you. So generally speaking, there is a lack of mentorship that a lot of people are like, I don't know, especially new grads. Love my new grads. And a lot of them are like, I just don't know if I can do early intervention because I'm not going to get the support and the mentorship that I need. And then the other thing too is working in early intervention can be really emotional. It can be very, very draining with kind of the clientele and the diagnoses and the stories and everything that we hear. I'm very passionate about the work that I do, but I'm also very open and transparent that working in early intervention is hard. It is hard work. I love it, but I know it's not for everybody. And dealing with some of the stories that I have seen just in my practice, and anybody else that is listening to this that also works in early intervention, I'm sure you have those cases, you have those stories that, pull on your heartstrings, and you just want to be able to do the best for them. But it's hard. It's not all fun and games and bubbles and scooter boards and, all of that. Like, it's hard work. And so, yeah, just the number of providers and practitioners working in early intervention, just it's not high enough for me.
Mm-hmm. Yeah, and I can just feel how those barriers that you're mentioned intertwine, like you're isolated and it's emotional and there's not enough funding and there's not enough practices for students to come to field work, and then they're not experienced enough, so they go to a different area. Like, I just see how all those barriers intertwine. There's so many levels on which we could do better. I want to ask you about them kind of systematically, and start with solutions just in your practice. What can one person be doing as an individual to help improve access to early intervention? And if there's anything we can also do related to service intensity to get to that level that we need. What can one person do? And from there, we'll expand in follow-up questions to broader levels. But starting there, what can we do on an individual level?
I really think it comes down to awareness and advocacy for early intervention, and really just getting the word out about what it is, who is there to support, and really what it does, right? I think in the general society, there's still there's just a general kind of lack of understanding and a lack of awareness that early intervention even exists in the first place, right? And then there definitely is a stigma that can be kind of tied into that as well, as a young kid, call it 6-month-old, 8-month-old, 12-month-old, anything like that, getting labeled, quote unquote, getting labeled with some sort of disability or disorder, or just needing support, even if there is no kind of official diagnosis or anything like that. And so I really do think it boils down to this lack of awareness and understanding of early intervention, that it's there and what it does. And I think as an individual, it really is up to us. For one of the things that we can start, there's lots of things that we can do, but one of the things that we can start to do is really start talking about early intervention. Thank you to this podcast, thank you to some other opportunities to really kind of bring this to the forefront of, like, hey, this is a amazing practice area, one that I love, but it's also one that is very often underrepresented, right? It's not talked about. It's not really showing up in the research as much as it probably should be. And so, yeah, there's a lot of things that we could do. But first, it really starts with, we have to advocate for this practice area, and we need people to start to know that it exists and start to know what it actually can do and the benefits that it has across the lifespan.
Mm-hmm. I love thinking about just lifting up those individual practitioners at that community level. Like, everyone should know who their local EI therapists are. Like, I think of my small town in Aurora, and I think lots of people know our EI therapists, but they don't know that they're EI therapists, if that makes sense. And if somehow we could connect that knowledge, I think more people would be like, oh, my child can have EI because that just means going to Kim and Carla. Like, that's literally how granular I think we could get, and how powerful that, like, thinking on that small community level is. That could make a huge national difference. Something that the article brought up, I love that it kind of ended with, like, we need better systems. Like, and I'll share some some supplemental research about that EI system out of Boston that just worked to improve their systems, and it made a huge difference. What do you think their OTs can do at that like communication systems level, kind of that, I guess, meso level of like your therapy clinic, the EI center, primary care? Like what can an individual do in that? Or yeah, what can we do at that level?
I laugh because I feel like there's so much that can be done kind of globally with the sharing of health information, right? And within the confines of HIPAA and all that kind of stuff. But I know that there are so many barriers with different doctors, different specialists, everybody being kind of on the same page and getting connected with the documents and the paperwork and all that kind of stuff when it comes to patient care. And personally, I know this from experience that just trying to get one like set of documentation from one doctor to another when they're not in the same medical network. I mean, I had multiple phone calls and hours just trying to like, I know the paperwork is there. Each one says they have it, one says they don't. That one needs to get it. And it was such a headache. I mean, and that's just me personally. That's not even with my company. Like that's me as the consumer right there. And so I know like globally, there is so much that needs to be done on this topic. And it's probably for somebody who is way smarter than I am, way more smarter. You like that? But I think one of the things as I was like trying to really like hone in on like what is something that an individual in early intervention or somebody that is passionate about early intervention, like what can we actually do? And I mean, I don't know if this could happen, but I'm like, in an ideal world, this would be amazing, is if we could have an early intervention representative or like a liaison at the hospitals, at the doctor's office, getting into primary care, at daycare facilities, at early childhood centers, where these referrals, for the most part, are coming from. If we could have a representative, somebody there, or at least checking in at these places and highlighting, hey, we're early intervention. This is who we support. This is what we do. This is our program. This is everything that that can be a part of a child and family's life. If we could get there and be tracking those referrals from the beginning, right? And even highlighting, right? Even like red flagging, like this should be a referral, even if it might not necessarily get a referral. Like we got to get on the front lines of this and be there to say, yes, this is a family and a child that we can support, or this is somebody that we want to get in and monitor and just make sure that they don't need any additional supports or anything like that. So for me, that would be amazing if we could really get out there and be at the places where the referrals are coming from and hitting the referrals before they're actually even a referral. Because I think going back to what you were saying right at the beginning of the episode, there's a lot of kids that aren't even necessarily getting referred that probably should be getting referred. And so that's where we need to be. We need to get there to make sure that we are targeting and identifying every single kid that could potentially be eligible and benefit from supports and services through early intervention.
Mm-hmm. Yeah, it feels like that relationship with that primary care doctor, that's what the research that I read on really focused on, was really bugging that primary care doctor to be like, you said they needed a referral, but you didn't write one. Like starting there feels so important. And then I think some states do have funding for like a patient navigator to help people go through that system. And I can just see the benefit of that. And that really comes down to like understanding your specific state's regulations and either advocating that they're being carried out or advocating that they improve. Also at that mid-level, we need more EI private practices like yours. How do we get that? What do you say to someone who has even an inkling of interest in that?
I want to touch on one thing before we get back to that question.
Oh yeah, totally.
One thing for me that since becoming a mom and having taken my kids to their pediatrician appointments and taking them kind of through some of these general health appointments, and my kids are 14 months and 2.5 years. So I'm living and breathing the early intervention life right now. Yeah. I am deep in the weeds right now. But it really has kind of highlighted so many areas that I'm like, we need OT practitioners here and here and here and here and here. And one of my big kind of lofty dreams is that I really want to get more OT practitioners in primary care and have them in the pediatrician offices, right? And this goes right back into those referrals where we can then also identify if it is a kid that needs early intervention, but we can also educate. We can educate the parents and the caregivers on things that I feel like doctors are amazing, pediatricians are amazing. I'm not bashing them, but they have so much information that they have to go through with, each of these there's so many things that happen at the 1-month appointment, the 2-month appointment, the 6-month appointment, the 9-month appointment, right? All of these appointments, there's so much stuff that has to get through. And I feel like there's so much stuff that I know as an OT practitioner that my pediatrician's just like, oh yeah, go ahead and start solids at 4 months of age. And I'm like, hold up. There's a whole lot more that goes into that, right? And I know from my training that it's not just the age, there's all these other things of readiness skills and all that kind of stuff. And so I really see the importance of getting OT practitioners there in primary care, have them have a role for the referral system, but also for that education piece in general. And that is something just within the last couple of years that has been brewing inside me, that I'm like, I feel really passionate about really trying to get more OT practitioners involved in primary care, specifically within pediatrics, but again, across the lifespan.
Our discussion today feels very United States centric because we're talking about the barriers of these programs, but to find these kind of solutions that you're talking about, we really need to look globally because those things are happening around the globe and we're laggards here in the United States. So that is definitely a future episode of the OT Potential podcast, I think. But swinging back to people starting their own EI business, how do we need to encourage those people?
Do it. If you are an OT practitioner or a student, once you become a practitioner and you have a passion for early intervention, you have a passion for private practice, do it. I'm going to be honest, and I said this in the beginning of the episode, like I'm a very honest and open, transparent person. It is one of the hardest things that I have ever done. Starting a private practice is really, really hard. In the beginning, I was working ungodly hours. I mean, I was working 12 plus hours a day and waking up at 5 a.m. and starting on my paperwork and checking emails and responding to all this, and then going and treating 8 to 10 kids, hour-long sessions, driving all throughout Los Angeles, going home, trying to get a quick workout in, to maintain my mental health, and then at the end of the day, trying to finish up all the paperwork and do all the reports and respond to the emails again that I missed throughout the day and all that kind of stuff. It's really hard, but it is so rewarding. It really, for me personally, has added so much to my life. I love what I do. I don't really consider it work because it's just something that is so, I don't know, it's like a part of me now where I love early intervention. I love the work that I do. I love supporting the children and the families. I love also being able to support the early intervention team and the program, right? Because I'm only one small portion of the early intervention team as a whole. And, voicing concerns and tracking data and bringing things up to potentially make changes in the early intervention team as a whole, which is something that I'm actually in the process of doing right now, and supporting the other providers and that type of stuff. But then also being able to support my employees and the therapists that work alongside me. Starting my own practice it's changed my life. It really has. It has given me this whole new sense of purpose that when I was in school, when I was a new grad, I didn't know about early intervention. I never thought that I'd work with babies. And now it's like, I can't imagine doing anything else. And I'm so glad that I was able to find this practice area and then was able to get over the fears of actually starting a private practice, because I was a reluctant entrepreneur. I never thought that I would be a private practice business owner. I never thought that I'd be an entrepreneur. When my husband first mentioned, like, oh, you should start your own thing, I laughed at him because I was like, there's no way. I can't do this. I don't have an MBA. I have no business knowledge. I'm an OT. I know how to work with people, and that's it. But that's okay, because at the root of what we do, that's the most important thing, right? Having those clinical skills, having those people skills, having the soft skills, which I hate the term soft skills because they're not soft. They are very, 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 very important. Being able to work with people, and what our training is as an occupational therapy practitioner is, bottom line, that is like so imperative to running and being an entrepreneur. And the other stuff you can learn, right? It takes time, might take some money, might be some blood, sweat, and tears, but you can figure it out. So anybody that really is interested in potentially going down this route, you can do it. It's needed, and it's not going to be easy, but it will be totally worth it in the long run.
Yeah, it feels emotional for me to take in. I'm an entrepreneur too, and we're at similar spots in our journey, and I feel absolutely the same way. I had a middle school teacher who said, I know a lot of you who want to help people will go into healthcare, but I want you to also think about starting a business, because that's going to help so many people. And we're lucky as OTs to have the option to do both. So It's hard, but I hope more people do it.
And I think it's also like, when you're a practitioner and you are working one-on-one, or maybe in very small groups, maybe like 1-on-2 or something, 1-on-3, the number of people that you can support is small, right? Like, let's be real about it. Like, it's small. But when you are able to start a private practice and hire on a team like I have done, you think about kind of that exponential factor of, now how many people can I actually support? I can support the therapists that work alongside me, and then how many kids are now they supporting, right? And you really kind of get out of the kind of like granular, very individualized lens, and you start thinking like, wow, exponentially now I am working and being able to support so many other people because of starting a private practice. And it's very humbling, right, to kind of think about that and be like, wow, I can really have so much more ability to support people, even if I've never met them, I've never worked with them, right? But me being here and being able to run my practice can have that influence. And it's, I don't know, it kind of leaves me speechless a little bit.
Mm-hmm. Yeah. I wanted to touch on the state and federal levels of advocacy that need to happen. These challenge and barriers we're talking about. I'm a big believer that one individual can do a lot, but really these challenges will require so much collaboration from the OT community and the OT community working with other communities. What do you see as the most important things to be asked for us to be doing on the state level and then on the federal level?
Great questions. And this is something that I think will continue to need more thought and just kind of more reflections on this, because I do think there's a lot that we can do. And it's really kind of figuring out what to start with, and then what are the most important kind of steps to take moving forward. And again, I think I said it earlier, but more advocacy, more lobbying, more awareness, right, of early intervention, more funding, of course, everything. It all comes back to money, right? And having the financial ability to support and give opportunities for early intervention growth and for the programs to be able to do what they can do. And then again, more research, right? Like I said, we didn't have any OTs as a part, or at least they weren't listed. I'll say that. Maybe they were kind of ancillary in the article that we are mainly talking about today. But where are the OTs in the research about early intervention? And hey, I'm not calling out everybody else, because I know that I haven't been doing it either. But I really think that we do need more research. We need more occupational therapy practitioners involved in the research revolving around early intervention. And I think this all kind of then ties in together the representation at conferences, whether this is at your state conference or maybe at your national conference, at the American Occupational Therapy Association conference. Woof it, right? Let's talk global. We'll start small, and then let's talk about the World Federation of Occupational Therapists. We need more research, representation, advocacy, awareness of early intervention at all of these different levels. And I think, and Sarah, you kind of touched on this a little bit, tying it all together with early intervention and private practice and entrepreneurship and all this kind of stuff. But I do think getting more grant money, having more startup money being allocated for small businesses like myself and businesses that want to get started in early intervention to be able to provide the supports and services. That would be huge, right? Money is we're talking about a lot about funding. Money is a huge barrier for people getting into early intervention and starting their own practice. So, if there was a way to have more money invested in these companies and these organizations and these practices to then be able to provide the services and build the teams and staff the programs and all that kind of stuff, that would be absolutely amazing.
Mm-hmm. Yeah, and we need people who are doing things successfully to be sharing how that's happening. I'm just seeing a world where every state conference, there's a state of EI every single year where there's data that we're gathering and building on. And same at our national conferences, that should be maybe it is, but I'm not aware of it. It should be standing sessions. We have a National Backpack Awareness Day for the AOTA. We absolutely need an early intervention awareness day. That just feels like the biggest miss. And the more data that gets gathered, the more that we can share it. I don't know if this probably exists, but you should be able to see the state regulations related to EI side by side so you can see where your state stacks up. And that helps so much with advocacy. And we should have printed brochures that every OT can take to Hill Day. And there's a lot we can do. And I'm also, I guess, saying this and being like, what's OT Potential's role in that? Because I just feel so passionately about this that I think there's things that we could be doing from a continuing education perspective too. And I guess if people have ideas, let me know, because I would love to do that.
Yeah, I think, again, this is kind of a little personal note here, but when both of my kids were born at the hospital, and Sarah, I'm curious if you had this with your kids, we actually got a little, for lack of a better term, a little swag pack, a little swag bag.
Yes.
With a bunch of pamphlets and brochures, and there were lots lots of different things that they were talking about, milestones. And like one of the things that stands out to me that I absolutely loved with my son, so this was in Colorado, that they actually gave us a library card. Well, gave him a library card, and that to like promote reading. And I think they gave us like 1 or 2 books and talked about like how to foster reading and, just a love for books with your newborn, right? Which most parents are just trying to figure out like how to navigate life with a new little baby. And I remember just like sitting there, and of course I was probably just like super hormonal and whatever because I had just given birth, but I was like, oh my God, this is so amazing. And I was sitting like reflecting about this article and thinking about things that we could do. And I was like, hey, why isn't early intervention in these swag packs, right? Like just as building awareness, putting in some sort of flyer or whatever it is to say, hey, if you ever have concerns, not that you will, but like if you ever have concerns, these are the steps that you need to take. Talk to your pediatrician. There are programs there that are early intervention and that this is what they can do and yada, yada, right? And not even starting there, right? Like that was just one idea that I was like, we need to get in those swag packs. We need to be with those library cards because we are just as meaningful and purposeful. But also like talking about it early and talking about it often. And I think again, like it's hard for me to, not pull in my mom lens here, but even talking about it, like bringing it up at the prenatal appointments, the OB appointments, where it's not like we're saying, oh, there's concerns, but it's just, hey, there is this thing later on. If you feel like you ever need additional supports, there is this thing called early intervention. And if you ever have questions, come back to me or let your pediatrician know. Like, bring it up and talk about it. I think talking about it and really trying to kind of shed light and bring this awareness of it is really, really important. And I feel like for me, I already knew about it. So I'm going to my appointments and I already knew like if there was an issue with my kids or if there was something going on with my kids, if I had a concern, I knew that I could seek this out. But not everybody knows that. And a lot of people still don't know about early intervention. So get on my soapbox about that. But yeah, it's just really, we have to get the word out there, talk about it, and continue to talk about it.
I really believe that early intervention is the crown jewel of our federal and state programming, and it should be lifted up as such. And every year we need to be looking at that crown jewel and polishing it up like that.
I love it.
It's such an amazing program. We've talked about so many things today. I feel like there were a lot of beginnings of ideas, but I want to close on, what do you want to say to the OT community specifically to help us rally around this issue?
Show up and do the work. If you're passionate about this practice area, don't be afraid to jump into it. It is an amazing, I feel like I say that all the time, kind of a broken record about it, but it really is this amazing practice area that is still very much not talked about enough. It's very much misunderstood. I mean, you kind of throw like occupational therapy, it's still like a lot of people don't know who we are and what we do. And then you have early intervention and it's like, a whole nother can of worms of people are like, oh, wait, what? Now there's OT and early intervention. What is going on here? There's so much potential. There's so much OT potential that we can do in early intervention. And I really just think that anybody that is interested in this practice area, try to get involved. Try to get involved in whatever capacity that you potentially can. Even if you're not even working in early intervention, but you're working in other practice areas where you might see some of our early intervention graduates, right? So talking to the school-based occupational therapy practitioners or the clinic-based, the older pediatric practitioners, and all the way up into adulthood, right? Like even if it's not necessarily right after they graduate early intervention, but you might be seeing some of the clients and the families that early intervention practitioners have worked with in the past. And I really just think that early intervention is one of those practice areas that can have just such a huge impact on so many other areas within life and kind of throughout the lifespan. And so I think we need the right supports, we need the right funding, we need the right people, we need the advocates, we need the people that are not afraid to stand up and voice the concerns and be the voice for early intervention. So yeah, let's do it. Let's rally the troops.
Oh, Sarah, you have been such a voice for OT and early intervention. And thank you for all the work you do on the advocacy front and in your private practice, and for lending your voice here to us today.
Thank you so much, Sarah. I am honored, honestly. Like, I'm just going to take a breath. I am honored, always honored to speak with you and to come on your show and really have this opportunity to be on your platform and share about early intervention, about my passions, about my private practice. And I'm pausing because I know there's so much work that needs to be done, but I also know there's so much good work that's being done as we speak in the realm of OT and early intervention. And it's exciting. And I know that there are going to be big things to come in the future. So thank you so much for having me. This truly was a blast to be here.
Thank you, Sarah. Wow, you all, talking to Sarah always gets me so fired up about early intervention. I feel so committed to helping us find new ways to lift up this very important practice area. If you have ideas about what OT Potential can be doing, please message me. We do have a guide for early intervention on our site that is perfect for you to share with your community. If you are an early intervention therapist, we encourage you to tag yourself on our OT Near Me directory so people can see the EI therapists in their area. We will also be updating our content on how to start a private practice to go along with this episode and hopefully inspire some of you to start your own OT business. And if you are interested in earning a CEU certificate for your time today, what you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in the club, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. And as always, I want to thank you so much for joining us today. I hope this podcast helps keep you informed and inspired as an OT professional. Take care, and we'll talk next time.